Hello, let's continue with our session on overview of diagnostic stewardship. Let us understand the phases of laboratory testing. The phases of lab testing include analytical phase, and post-analytical phase. While pre-analytical phase is related to the specimen collection, storage, and transport, analytical phase includes specimen processing, while post-analytical phase includes release of the reports. So let's see what happens in the pre-analytical phase. Pre-analytical phase is the collection, storage, and transport of the specimens. Let us understand the essential things about the pre-analytical phase. When should a specimen be collected for bacterial culture? It should be collected prior to antimicrobial therapy and the case definition should be fulfilled. Then what kind of specimen should be selected for culture? It should be an appropriate specimen from the site of infection. How should the specimen be collected? It should be collected by trained staff with strict adherence to precautions, using appropriate technique, using correct material and container, ensuring adequate amount of specimen, using appropriate transport medium, and ensuring correct labeling. Then how should the specimen be transported to the laboratory? It should be transported in the correct package for safe transport. And it should be transported to the laboratory within 2 hours after collection and at room temperature, that is around 20 to 25 degrees Celsius. And in the correct storage at the healthcare facility if necessary. And it should be accompanied by a request form with complete clinical, demographic, and epidemiological information. So that is about all the critical things that is required for the pre-analytical specimen management. What are the types of specimen that we get for the laboratory testing? It is a blood specimen, stool specimen, urine specimen, genital specimen, expert specimen, and respiratory specimens. What are the principles of the specimen collection? Collect the specimens before antibiotics are administered. Collect specimen with using a sterile techniques. Collect specimen as close to the site of infection. Collect specimen at the right time. If more than one blood tube is ordered, follow the order of collection. Adequate sample container should be used. Check the expiration date and check the transport time of the sample. Correctly label the container with adequately filled requisition form. Adequate volume of the specimen should be collected and transport the sample as early as possible. What should be the order of flow? If multiple tubes are collected, this is from the slide. You can see the order of flow. If the blood for the blood culture, for the organisms, for the cytrum, it's the color tubes are bluish color, and other such examples as you can see from the slide. The blue top is for the coagulation determinants. The red top is a plain tube for serum test. Then gold top is a gel separator tube, and other these are the examples of the waste tubes. And then also accordingly we have needle syringes or needle sizes of 21 to 23 gauges suitable for most of the samples. So this protocols needs to be followed. The correct tube needs to be used for collection of the blood. The correct needle size needs to be used for the specimen testing. Ensure appropriate labeling of each container. Every individual tube, container, specimen sent to the lab must have a label applied to it. No pre-labeling should take place as it can lead to errors, serious errors, always at the patient bedside. Label each specimen container near the patient bedside, and not the container. It should be the container should be labeled and not the container lid. And with the information such as patient's full name, the patient medical record number, the date of collection, the time of collection, and the specimen description. Let us understand about turnaround time. The turnaround time should be as less as possible for the immediate patient care. For the turnaround time, once the specimen has reached the laboratory, the turnaround time is the time to the release of the results, and it will depend upon the diagnostic tool used and the processing procedures. Clinicians should be kept informed of when they can expect the results of the specimens from the laboratory. This applies to preliminary results such as gram stain results or other such microscopy results, initial growth, the provisional report of the growth on the culture plates, and the final sensitivity results. They should be made aware that the final results from the culture-based identification and sensitivity testing may take several days, at which point empirical treatment should be reviewed and may be needed to be adapted accordingly. Regarding storage and transport, correct storage and transport needs to be followed in order to be confident that the results provided by the laboratory are accurate, significant, and clinically relevant. Much depends upon the quality of the specimen sent to the lab for analysis. Hence, the specimen must be labeled correctly and must be accompanied by standard requisite form. SOPs should be available with instruction for appropriate collection, storage, and transport of the specimens. So let us revise ourselves with the different critical things required for each of these phases, that is pre-analytical, analytical, and post-analytical. The pre-analytical, properly filled requisite form is required, correct container and packaging, and adequate amount of specimens required, and correct transport mechanisms will be followed. While in the analytical phase, trained personnel, good the equipment should be according to the samples to be processed. The purchasing and inventory protocol should be available. Process control should be in place. Internal and external assessment of the sample processes should be in place. Process improvement methodology should be in place, and the facilities and safety should be there for the processing of the samples. What is post-analytical phase includes then is a reporting format, as I said before, with references, regions, and selective reporting of the sensory testings. Interpretation of the results should help the clinicians differentiate contamination from and colonization from infection, and it should be good communication of the results of the laboratory to the clinicians. There should be documentation of the laboratory results, and there should be retention disposal of samples according to the guidelines. So we have seen about the pre-analytical, analytical, and post-analytical phases, and there are critical things to be followed. What are the challenges or the errors? Ordering of unnecessary testings, wrong timing of the testings, wrong sample collection, wrong technique, inadequate volume, poor specimen quality, improper requisite form, delayed transport, and wrong containers are different errors that take place in the pre-analytical phase. What is the result of any laboratory is, let us understand the result of any laboratory is only as good as the sample received in the laboratory. The diagnostic result depends upon the quality of the specimens, and it directly affects the therapeutic decisions and thereby the patient outcome. Poorly curated specimens or the transport mechanism forward fails to isolate the causative microorganisms. It fails to recover the true pathogens, and instead we get the contamination of normal flora grown on the culture plates. It is like garbage in and garbage out. So hence, true specimens or correct specimens should reach the laboratory for testing. Once optimal feedback and reporting of the results is also important. Optimal patient care depends upon good communication between the clinical staff, the microbiology laboratories, and the surveillance staff. Clear procedures should be in place for the communication between the clinical laboratory and surveillance staff. Procedures should state, for example, how rapidly results will be communicated, on-call availability of the lab staff, and include provision for regular meetings to discuss the results. Clinicians should expect to receive reports in a timely manner, including interpretive comments that enables the results to be applied for patient management. Results should be stored and should be accessible in the patient files and also in LIS. Lab must also report negative results if critical from the specimen. What's the rationale for the requisition form? It allows interpretive reporting by the laboratory. It allows differentiation of contamination from infection. It allows automated reflex testing based on clinical interpretation. Allows choice of antimicrobial agents to be tested. It allows special testing in special groups. So that was about the details of pre-analytical, analytical, post-analytical prerequisites and the challenges. The conclusion is antimicrobial stewardship means is using the right drug at the right time at the right dose for the right duration. While diagnostic stewardship means to obtain the right test in the right patient in order to use the right drug at the right time at the right dose for the right duration. That's all from this session. We'll proceed to the next session. Thank you.